Welcome back to The Narrative. I'm your storyteller, Callistra Faria. The government of Grenada making new moves in its landmark project, the Smart Hospital that the government of Grenada, led by Prime Minister Dickon Mitchell, says will revolutionize healthcare and make it more accessible to Grenadians. It's called a Project Polaris. It takes into consideration a smart hospital costing millions of dollars on 84 acres of land in Hopevale on the southeastern side of Grenada. Attorney Andrea St. Bernard, who is the project sponsor, joins me on The Narrative to talk about Project Polaris, as well as an agreement signed with Mount Sinai Health System in New York. Welcome to the program, Andrea.
Thank you, Lister. Thank you for having me.
Well, you know, Project Polaris, it's something that when we hear about it, it's exciting, it's needed, but there are a lot of questions because it's a new area that we're really going into, which is a smart hospital. Can you break it down for me? What exactly are we presenting to Grenadians on this 84 acres?
Thank you, Lister. You're absolutely right. This is a very exciting project. I think it's a long overdue project for Grenada. It's certain that we need to improve healthcare generally. Project Polaris is a project about the development of a new hospital, which is really the cornerstone or will be our North Star as we move forward with the improvements in healthcare in general. So Project Polaris is Grenada's bold and strategic step towards becoming a global, modern healthcare system. At its core is the development of a state-of-the-art, climate-resilient, smart research hospital, which will be located, as you said, in the 84-acre plot purchased by the government in the Hopevale, which will become the Hopevale Medical City in the Hopevale area, which is just on the border between St. George's and St. David's. So the new hospital will be a 250-bed hospital. It'll deliver high-quality, patient-centered care. It'll have advanced clinical services, provide opportunities for training, research, and innovation. And it will also be designed for long-term growth and environment sustainability. It'll offer tertiary care, nephrology, outpatient and surgical services, and it'll serve really as a hub for local and international collaboration in the medical sector. But Project Polaris really is more than just a hospital. It's a catalyst for national development. And so over the course of the project, the broader medical city will be built out. And this will evolve to include and to offer Grenada the opportunity in the areas of medical tourism, elder care, biotech innovation. So there's a lot of opportunities that will come out of the build out of the medical city. Again, the cornerstone of which is first, we have to build a new general hospital for the people of Grenada.
And your title in all of this is a project sponsor. This is an investment-based project or a fully funded by the government of Grenada project?
Yeah, this is a fully government project. So the government have themselves committed to their own equity investment into the project. As you would have heard in the annual budget, there's 25 million that the government has already set aside for the government's equity investment. The additional financing components will be, and we are in the process of securing, we'll be hopefully back with the full package soon, but it'll be a package mixed of loans, grants, donations. Because it's a fully funded or a fully backed government project, when I say debt, in fact, we have the opportunity to access concessional level debts. So we're looking to work with funders who can provide the government of Grenada concessional level debt to assist with and to fund the construction of the hospital.
Now, currently, Grenadians do not really pay for healthcare in the proper sense of the word. And one of the questions that people ask is, how will the average Grenadian be able to once millions and millions of dollars goes into a project, then one expects that there is going to have some returns on it to maintain the project, to maintain the services. But I'm not really hearing much about a health insurance, which we all must agree with, all that many Grenadians would be locked out of what is being touted as more accessible healthcare. How are we looking at the affordability of the facilities at Hopevale when that project finally is completed and up and running?
I think you're absolutely right to identify national health insurance as the linchpin to that, and the government is absolutely committed to that national health insurance. So I would say stay tuned. It's definitely something that is coming. It's not coming directly through the Project Polaris team, but it's coming. The government is working very hard also on national health insurance. Absolutely, the idea is that the new hospital will also be available and accessible to all Grenadians. And so uh, the current system of how the government backs healthcare at the hospital will have to be replaced, modernized into a different system, which will certainly include national health insurance to ensure that all Grenadians maintain access to the new hospital and to the healthcare being provided in Grenada.
And when we look at the business model that will be utilized for Project Polaris for the new hospital, how do we, yes, people paying for their healthcare services, but it's a lot, it's much more than that. How do we intend to make this project pay for itself?
So there's a lot of layers to essentially building an ecosystem around the hospital such that it has the opportunity to be really the government has the opportunity to earn revenue through medical services and not just have it as a drain on government resources. There's no doubt the government will have to continue to back and put forth significant resources investing into the people's health, ongoing health services. However, the idea around building this world-class, state-of-the-art institution is to have health services, world-class health services available to Grenadians. And really the sustainability of that then expands into, we also believe that we would then have world-class health services that are not available throughout the OECS, which means it provides us the opportunity to then start using that excellence as a medical tourism attraction. So both the hospital itself would be provisioned to provide services to additional patients beyond the people of Grenada, so persons within the OECS. But we have also been working very closely, and as I said before, 2024, 2025 have been planning years. We spent quite a bit of time finding the right partners and working with the right partners to put together the plans. And so one of the plans that we have been working on, one of the areas of research and reporting that we have been doing, led by Deloitte, again, a very well-known firm, is our research into medical tourism and even retirement tourism. And so as we develop the medical city, we will be looking to develop essentially, as I said, the additional services, additional tourism opportunities, additional ecosystem business opportunities that will help build the necessary ecosystem to allow for additional revenue to come into Grenada that would certainly then be used for ongoing sustainability of the operations of the hospital.
Let's look at timelines here. What sort of timeline are we looking at for the decommissioning of the current general hospital space, if it's going to be decommissioned, and the commissioning of the general hospital facilities within Project Polaris?
So it's a very ambitious project plan and timeline, that's for sure. But we are committed to achieving it, and we are working diligently with the contractors that we are bringing on board to ensure that they understand our timeline expectations as well. So we expect that we are in 2025 now, that we will be commissioning the hospital, the new hospital, in circa 3 years. So in 2028, we should be commissioning the new hospital. Now, certainly, we do plan, the new hospital is intending to replace the old hospital. And so there will certainly have to be a transition for moving from the old hospital to the new hospital as the main general hospital. I can't speak to the details of that plan at this point, but that is certainly where we're heading.
Said 2028, but do we have a specific time? Is this project is going to take us 4 years, 4.5 years, 3 years?
We're in 2025 now, so we expect the construction to begin in 2026, and we anticipate it'll be a 2 to 3 year construction period. So we're pushing to open in 2028, around that timeline. Again, we're in finalizing contracts with construction firms, design firms, etc., working specifically with these timelines. It's very important that we, again, run very rigorous processes to find the right partners, that they have experience and expertise in delivering on these types of projects, on delivering on the types of timelines that we're expecting and mandating. And so that is the current timeline structure that we are working on. As I said, as we are still in the planning phases, there's some, you'll have to give me a little bit of area for flex as we continue to flesh out the plans, the contracts. But yes, we're looking at 3 to 4 years of project.
What governance or decision-making structures will be in place or being put in place to manage this project?
So the project is absolutely a top priority for the government of Grenada. The cabinet of ministers have identified improving healthcare and the building of a new hospital as one of the top priorities. Acknowledging that it is a very big and ambitious project, we then looked at what would be the best way, or how are we going to deliver on such an ambitious project. A project like Project Polaris is multi-sectoral. It crosses several ministries. It will take resources from across all of government, as well as throughout the private sector that will have several partnerships. And so because each ministry has to continue doing its usual business while we undertake a very ambitious, bold, and strategic project such as Project Polaris, the Cabinet of Ministers have themselves identified a subcommittee of ministers whose ministries are intersecting with the project. They form their own subcommittee for Project Polaris, and then they've appointed a delivery unit, and this is where I've been appointed as the project sponsor. So ultimately, I'm accountable to Cabinet, in particular, have a regular reporting requirement to the subcommittee of ministers to ensure that the project is delivered on time in accordance with the goals and mandate of the government. And so this is how we've ended up with this Project Polaris delivery unit, which, as I said, is accountable to the Cabinet of Ministers.
Now, sometimes we build things and we don't remember that we have to take care of it and maintain it going forward when we're costing and budgeting. Will things like ongoing maintenance and the technical support that's required for an undertaking, such as is conceived here for Project Polaris, is it in the current budget and fundraising that you're looking at? Or would we have to look at more allocations and more sourcing of funding going forward after the structure is built?
So that's a good point, a great point, actually, and I think is something that we're very cognizant that we do build in a maintenance plan, an ongoing maintenance plan. And so, in fact, right up front, our approach, and as we are finalizing our contract, our design and build contractors, we're building in a maintenance component even there. So yes, absolutely, the contracts that we're looking at up front and the commitments that we're making up front account for and include the maintenance, so go forward obligations, so that we are in a position to maintain the standard.
You know, when we talk about a smart hospital, if we are to call a spade here, I I'm not sure whether or not we have the human resource capacity for this project. Are we also working simultaneously as we build this structure with developing the human resource and capacity within the nation to be able to service this hospital?
That's essential, absolutely. And I think one of the exciting areas of the dynamic space that we're in, it's as I said, a multi-sectoral project which will touch upon so many areas. But really, this is where the opportunities are for Grenadians, even as a matter of education, career path, business opportunities. The government is investing significantly into the health sector to improve health service for Grenadians. The result of that will be a dynamic space with a lot of activity, which will need professionals, which will need service providers, which will need a lot of additional development for the people of Grenada. So we will be working, and we are working very closely. Again, this is why the subcommittee of ministers involved in Project Polaris includes, for example, the Minister of Education. It includes the Minister for Youth. It includes the projects involved in the team includes SGU even. And so, yes, absolutely, we have to put together plans, and we're working very closely. The government will certainly be coming out with more information around this area because absolutely, we are going to need to improve our stock of medical allied healthcare professionals, so the supporting systems, as you're speaking specifically about, even the IT components. So this is great. So it's not just persons who are interested in pursuing medical professions who could potentially see a future through the development of the Project Polaris medical city, but it's also persons with interest in IT, with interest in a variety of different things, because the opportunities will arise from this world-class institution. So we, again, are working with are working to get the right partners to help us to formulate those plans. Working with Mount Sinai in particular is going to help us with our recruiting, our training opportunities, our mentorship opportunities, developing our overall human resources plan, and how we would continue to evolve and develop. Those are the types of key roles that Mount Sinai will play in assisting us with developing in those areas.
Built into arrangements, I know we've already signed an agreement with them, built into these arrangements, an agreement for knowledge transfer as well.
I think that's one of the main components of the relationship with Mount Sinai, and really the main aspect of what we can expect to gain. Mount Sinai offers us clinical expertise in areas that we don't have clinical expertise. So they've already begun, for example, looking at our clinical services plan for the new hospital to help identify areas that we are deficient, areas that we need to gain to move into. And of course, they'll have to help us to build out new service areas. Mount Sinai is going to allow us access to their global resources as we make the necessary plans, which is quite a significant global resource of over 48,000 medical professionals, for example, institutions. They've obviously also got access to the IT personnel, the systems administrators, the overall operators that can help guide us as we are planning and setting the standards and the organization structures for our own hospital. The relationships that they offer us, really, the opportunity for us to have Mount Sinai expertise visiting us, joining us in Grenada, assisting with the implementation of policies and procedures that would have been set. So they would help us with setting the policies and procedures. They're also already on the ground working with us at the existing general hospital, implementing upgraded policies and procedures and making sure that we can see that incremental improvement of the overall status at the existing hospital, but as well as the service and quality of service being given. So really, it's that knowledge transfer, it's that continuing engagement from Mount Sinai offering us their world renowned expertise and experience in delivering health systems to help us to really bring up all of our systems, policies, and practices. And in fact, we anticipate that knowledge transfer will not just be from Mount Sinai to the hospital, but in fact, we will be pushing to see those improvements of policies, care, and standard throughout the healthcare system in Grenada. And that's, again, one of the key integration aspects.
To what extent will Mount Sinai Health System have a stake in the hospital in the project?
They are
Are they a partner? What's their designation within this project and their financial
as
stake
we've
in it?
explained, so there's nothing more to it than the collaboration that they've committed to with the government of Grenada to work with us to raise our standards and health service. They don't have an actual stake in the hospital beyond their role to help ensure that we have enhanced, improved quality service delivery.
Well, let me ask you this. Are there any special conditions within the agreement between Grenada and Mount Sinai, between the people of Grenada and Mount Sinai, government and people of Grenada and Mount Sinai, that requires us to do anything except build the hospital and receive their knowledge, their expertise, their resources under the agreement we have with them?
That's, very simply, the nature of the agreement. They agree to provide us their the benefit of their expertise and, as we said, the world class operation, their world class operating systems, healthcare systems, the personnel that they have with the experience in delivering that. They also do this type of service consulting to help raise quality of service internationally. So there are several countries that they have embarked in various consultancies to help raise quality of service. So that's their role, is to assist the government of Grenada in that endeavor.
Does the agreement contain any conditions on nations that we can deal with in terms of having medical and healthcare professionals work at this hospital?
There's no conditions in that regard.
What would you say are the risks and challenges, well, potential risks that what concerns you most about this project as project sponsor? What keeps you up at nights as you look at the scope of this project before you?
So I can't say that there are many things that concern me, because I do believe that we have taken our time to identify what are the necessary components for a successful project such as this. We've been very careful to follow a very rigorous process. We have done our research to understand what does Grenada need. We've started in the very early stages with consultation with PAHO, for example. We know that there have been feasibility studies available to Grenada for over a decade, indicating the absolute need for a new hospital in a more accessible area. To be honest, I'm just overwhelmed with excitement about how well the project is doing, and the reality is it's an absolute need. And so I think it's the right move for the government. I can't say that I am afraid or I have any fears at night. I have there are certainly a lot of challenges ahead that we all know would be. It's hard work. It will be hard work. Certainly, one of the areas I think we need to certainly focus on is improving quality service in general. So the work that Mount Sinai has already embarked on at the existing hospital is critical. And I think this is an area we need to maintain focus. What are the things that we're doing to make sure that we improve primary health care? What are the things that we're doing to make sure that we improve the standards and quality of services right now as we're planning for a new hospital? There's a lot of work to do to transition from where we are to where the vision is. So I think there's certainly a lot of challenges that keep me thinking, but we have, as I said, we're getting the right partners at the table. So we're very confident that we're putting the plans together. We are identifying the challenges along the way and creating the necessary plans to mitigate or overcome those challenges.
Based on the audit that Mount Sinai had done of our current system, are we taking any steps to improve the level of services that are available? Let me put it this way. There's a lady right now, she's dying. She needs an angioplasty or something like that. It can't be done here. It's $150,000 in Trinidad and Tobago, the closest place, cheapest place. She doesn't have the money. She's probably going to die because we don't have what's needed here. While we wait on the building of this smart hospital and paying for our health care, how does this audit that has been done try to even mitigate or address at some level things like that, where people die because there isn't a surgeon or a piece of equipment at our hospital to do a procedure that in other jurisdictions is run of the mill?
So I think that's the one of the concerns that leads to the overarching need for Project Polaris. Certainly, we need to have better service. We need to have more services. The solution to that is not a quick fix. There just isn't a quick fix to that. The solution to that is the strategic plan to have a new hospital, because we know the existing hospital infrastructure just isn't going to cut it. So really the plan for getting additional services available to Grenadian people comes with the commissioning of the new hospital. However, it's essential that not just that we add new services, but that we make sure that the services that we are providing now are provided at a high standard. It's important and essential that we ensure right now that the patient experience is enhanced. And so the focus of Mount Sinai at the existing hospital is really to address the existing practices, policies, and culture so that we can see improvements right now with respect to what the existing hospital can deliver, the services that they can deliver. We should and will see improvement in the quality of the service, in the quality even of the existing hospital environment, as various things are done to improve record keeping, to improve flow of patients, etc. So a lot of things are being done at the existing hospital to ensure that right now we address lower hanging fruit areas that we can address to improve the quality of service, to improve the patient experience, and to also start that knowledge transfer. So the medical staff working at the existing hospital are working already very closely with subject experts from Mount Sinai, specific to their particular areas that they're working in, to do exactly that, improve their policies, their practices, and it's an ongoing, so they've done an initial gap assessment, identified areas that need improvement, things that can be done in a short term, things that will take a longer term. They've sat and worked very closely with the staff and management team at the hospital to map out a plan to start working on those areas that have been identified that can improve. And over the past couple months, we can already see objectifiably improvements in areas that were identified along that work plan. And so we're very excited to see that work continue. In fact,
improvements in areas such as?
Such as, for example, record keeping, right? Think simple things such as record keeping. Our system, our process for record keeping is something that, for example, Mount Sinai would have gone in and ensure that we now have a better record keeping, just the actual physical record keeping is in a better status. It was actually quite not well organized. So there, a system has been put in place to reorganize, to categorize, as well as to identify things like old, outdated records, to put a policy in place to now have a regular system that identifies when should records be destroyed and what would be the process to destroy records. So we are lacking general systems that allow us to operate in a systematic way, which obviously leads to efficiencies. Another area, for example, is just storage.
Andrea, let me ask you this, Ms. Amanat. Better record keeping, better storage. doesn't,
Well, let me
it,
just say
it,
this.
it, it leads to efficiency. It leads to efficiency, I will grant you that. But it doesn't save lives. And so what I'm hearing here is that a lot of the services that are geared towards saving lives at the general hospital won't happen until we're in the new hospital. Because at the end of the day, some experts will say to you that yes, this hospital up there, it's small and decrepit, but it does not prevent us from having equipment and surgeons and experts who can do the
So
service.
let me just expand, for example, on the point that I was making about storage. So what will be our ability to service patients if we don't, as you said, maintain equipment, maintain the actual when we receive items, we don't properly inventory them. We don't know what's available. We don't know what is in our stocks. We don't maintain storage facilities at the right temperature so that when we do get equipment, it quickly becomes obsolete or unusable, right? These are all things that systematically have to be put in place to ensure that there's a process and a system, an ongoing policy procedure, and everybody understands how the pieces are all supposed to move together. Granted, those are two examples that are not actual patient care, but that's an example to say there's a lot of work to be done that has already started at the existing hospital. Retraining the staff around how they work to make them more efficient, to make sure that what have become internationally accepted standards for how hospitals operate. For example, the huddle system, where we ensure that the staff in a particular area have the opportunity to huddle at the beginning of a shift, debrief, understand where all the patients are, what are their needs. They have a regular system of then huddle or debrief again at a later point in the day. Now, these are processes that have become regular course in international standards, so JCI accredited or other internationally accredited standard institutions. But they're not practices that have been adopted in Grenada. So these are the kinds of things that are being addressed and looked at, and plans that are being put in place. And it's not an overnight process. It's a very long process. It'll take a lot of work. It'll take a lot of work from our own staff. They're the ones that are going to have to essentially take the information and make the changes, of course, with the guidance of partners such as Mount Sinai.
With Project Polaris, are you taking into consideration cultural challenges? We have grown accustomed to being within a particular environment, not the part where you can't get your life saved, but just that, people go to the hospital, they don't really pay for health care. We're accustomed to doing things a particular way for a long time. What Are there any cultural challenges that you've anticipated and taken into consideration in how you engage and roll out Project Polaris?
I think we are in particular focused on enhancing the culture amongst the medical profession and staff, ensuring that they have the right environment and the right opportunities for their own peace of mind, professional opportunity and advancement. I think that's a significant component of it. I do think we have some changes to make in that regard. I think absolutely, evolution is something we should continue to aspire to. This is definitely a new system, a new approach to healthcare delivery. As I say, if we're looking to implement national health insurance, I think partly it is that understanding that healthcare is expensive, and we absolutely have to ensure that we accept and acknowledge that and find ways to address that significant cost. And it would be really not reasonable to expect that the answer to that is that the government will just be able to come up with the necessary revenue resources to continue to fund all of healthcare, and to do so at a high level. So I think yes, we have to start shifting in our understanding of healthcare in general, because as you say, things have been done here have been done the way that they have been done here for a long time. And we are looking to shift the systems a little bit. So we anticipate there will be some cultural shift coming along with that. But as we look at the vision of where we're going, it seems to me clear that that's where we need to go. So we are encouraged that Grenada is ready for an advancement of this nature.
All right, I want to thank you so much for joining me here on The Narrative. Andrea St. Bernard, project sponsor for Project Polaris, Grenada's ambitious smart hospital project. I want to wish you good luck. A proper healthcare system benefits us all, and affordable to those who can't afford, and for those who can afford, that they pay. And hopefully, even at the old General Hospital, Andrea, I can use my card to pay for my services. I don't think they take cards there. Did Mount Sinai find a way to deal with that so that people can make payments if they want to make payments using their cards at the hospital?
Indeed, the new hospital will be much smarter. Thank you very much, Blistra.
Yeah,
I appreciate you having me.
Thank you. We look forward to having you back as the project progresses. Thank you.
Thank you.
This is The Narrative. I'm your storyteller, Callistra Farrier, speaking with Andrea St. Bernard. She's the project sponsor for Grenada's Project Polaris, which is a smart hospital that the government of Grenada hopes can be up and running in just about 4 years' time, breaking ground in 2026. They're now looking for additional funding for the project and looking at the other major fundamental issues for rolling out a project of this magnitude. When we come back, I will be joined by Ambassador Jerry Eno. He has lead for Oceans and the Blue Economy in Grenada, as well as Alexander Govan, who is a senior project officer. He's attached with the Ocean Coordination Mechanism. I spoke to them in an earlier interview about the OCM,